Hello, and welcome to this video presentation on endometriosis. My name is Dr. Kimberly Cheatham. The objectives for this presentation are listed on this slide. Endometriosis is the growth of normal endometrial tissue outside of the uterus. It is a common chronic condition that is not typically cured. The ectopic endometrial tissue can be found anywhere in the body, but is usually located in the pelvic cavity, along the uterosacral ligaments, on the ovaries, and in the posterior cul-de-sac. Endometriosis is found in up to 10% of all reproductive age women. Up to 50% of women with infertility have the condition, and women with chronic pelvic pain have an even higher incidence. We don't know what causes endometriosis. There is a genetic component to the condition, otherwise we're not sure. The prevailing theory is retrograde menstruation, but this theory does not explain how endometriosis implants can be found in distant tissue, such as the lung. Common symptoms include dysmenorrhea, dyspareunia, pelvic pain, and infertility. Endometriosis can also present as an adnexal mass. Occasionally, a woman will have no symptoms at all, and the endometriosis is seen at surgery performed for another reason. Making the diagnosis is important for patients who are having severe symptoms. You may suspect endometriosis by taking a detailed history and performing a physical examination, but to know for sure whether someone has endometriosis requires surgery, typically laparoscopy. Obtaining a biopsy of a suspicious lesion and sending it for examination is the gold standard for diagnosis. Because endometriosis is a chronic condition that is unlikely to be cured, we often treat patients with medication without performing laparoscopy. A high suspicion is sufficient to begin medical treatment in a symptomatic patient. Those patients who do not respond to medical therapy or who have severe debilitating pain are good candidates for laparoscopy, where endometriosis can be diagnosed and treated at the same time. Medical treatments for endometriosis are listed here. First-line therapies include NSAIDs and oral contraceptives. If these are ineffective, consider referral to a specialist. Upon referral, a patient may be scheduled for surgery. Surgery is usually laparoscopic unless the patient has severe disease with a lot of scar tissue or adhesions. The pelvis will be examined carefully for evidence of endometriosis. Any identified implants will be excised or burned away. If the patient is completed or childbearing, a hysterectomy may even be performed. Once endometriosis has been removed at surgery, the patient will need to use medical therapy to keep new lesions from forming. A clear indication for surgery is the finding of an endometrioma on ultrasound. An endometrioma is a cystic adnexal mass of endometriosis filled with old blood. These can become large and twist on themselves, causing severe pain. This is known as torsion, and occasionally they can bleed into the pelvis. Treatment with oral contraceptives after removal of an endometrioma can reduce its recurrence. Surgery is the gold standard for diagnosing endometriosis and is also helpful for short-term treatment. However, the recurrence rate for endometriosis is high. Thus, it is important to initiate medical treatment after surgery to reduce the chance for recurrence. This is the end of this presentation on endometriosis.